Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health. Subscribe to our YouTube channel to get your latest updates, and do join our Facebook group to get your everyday tips on your dental health. And today, in conversation with me on the Tooth Talk, I have Dr. Ranjani Rao. To give you a brief introduction about Dr. Ranjani, Dr. Ranjani Rao is a graduate from the prestigious RV Dental College and Hospital in Bangalore. Passing out in the year 2000, she has a rich clinical experience of 19 years in the field. She has an MPhil in Hospital and Health Management from BITS Pilani, with a fellowship in orthodontics and surgery and a mastership in implant dentistry. Dr. Rao is passionate about implant and aesthetic dentistry. Dr. Ranjani, along with Dr. Hema, manages two state-of-art dental practices in Electronic City, Bangalore. Dr. Ranjani, thank you so much for joining me in today's Tooth Talk conversation. It's so nice.
Thank you so much, Dr. And a big hello to all of those who are listening to us live or are going to listen to us later. It's always a pleasure to be back on Tooth Talk with your dentist.
Yeah. So what is the topic you have chosen today to tell our viewers? So talk to our viewers about.
Dr. Rekha, considering it was New Year,
Yeah.
I've had a whole spate of people coming in wanting to look their party best. And there's so much demand for bleaching. And I thought it's important that we address the rights and the do's and the don'ts about bleaching. So people can safely go ahead and do it if they are an ideal candidate, and those who are not can refrain from it. So we thought we should bust some myths about tooth bleaching.
Okay. So you said a tooth bleaching who's an ideal candidate. So what exactly do you mean by an ideal candidate? Who passes the test to get a bleaching procedure done?
Okay, so the most common reason why people come to us for bleaching is obviously because they want your teeth to look whiter. Okay, now you have to understand a little bit about color. There is brightness. There's a lot of character to the color of your teeth, and it also depends on the amount of light that is falling and how much of it is absorbed. And so it's a little bit of physics. But for the layman, if I have to break it down, there are stains that form over a period of time on the surface of your teeth. This can be removed with bleaching. Okay. Now, bleaching can remove stains which are on the surface, maybe a few millimeters down the surface. But if they are intrinsic and they are very, very deep-seated stains, no amount of bleaching is going to be able to remove it. So there are different categories. So, for example, if it's a big day, if it's a big event and somebody's getting married and or if it is a function or anything where they need to be at their presentable best, and how you would go and get your face bleached. Okay, I think that's the easiest comparison I can make for people to understand. And after 6 weeks, you will notice that your skin comes back to its original color, exactly how tooth bleaching works. So it's a temporary, it's reversible, which means whatever change in color we achieve is going to reverse back to original once the chemical stops doing its job. So that's a brief intro of what.
So what our patients need to understand that bleaching is not a permanent procedure. That means the effects of bleaching can get reversed, in the sense it can fade off over a period of time. And also considering the amount of spices and coloring agents like turmeric and all we use in our food, in our everyday food. So the chances of the color becoming, the whiteness becoming a little more duller is always there. So which means to say that after one sitting of bleaching, the patients probably have to revisit their dentist for like a touch-up procedure or some such thing. Say at the end of 8 months.
Yeah. So what causes the stain? Let's address the basics. So coffee, tea, cola, colored drinks, anything that contains a lot of color in it, haldi or turmeric, which is used a lot in Indian food, Chinese food where food color is used, smoking, very, very important, that nicotine forms a dark brownish black stain on your tooth surface. gutka, tobacco in any other form is also going to leave stains. So these are all particles or which can cause stains on your teeth. Some are permanent stains, some are temporary stains. So, for example, the coffee and tea over a period of doing it every day, say 1, 2, 3, sometimes multiple cups during the day, some amount of it gets diluted when you brush and clean and all of that. That's what the toothpastes are advertising for. So they're just going to be able to do the first round. Now, then the coffee and tea stains, most often than not, can be removed by what is technically called cleaning. Now, a lot of people come to us asking for bleaching and are confused when I tell them, look, cleaning is what you need. Bleaching is a cosmetic procedure. However, there are certain reasons, we call them as medical reasons, for actually bleaching a tooth. So, for example, if the tooth has undergone root canal treatment and there has been bleeding within the tooth, just like how you get a purple blue rash on your skin if you bruise because of the bleeding under the skin, something very similar happens to the tooth, and the tooth turns dark gray, brown, very, very dark brown in color. We use medical bleaching there, and that is done for a technical purpose, and it's not cosmetic. But if someone's just walking in to feel good, look good, a very cosmetic makeover, that is what is called cosmetic bleaching. There's also another big problem of fluorosis, which I think we should address. So some people come from areas, which means 0 to 6 years, that is from the time they were born to the first 6 years of their life. If they have spent in an area where the groundwater contains excess amount of fluoride, then the fluoride gets imbibed during the formation of the teeth itself. And so they have certain brownish red stains, which could either be just on tiny surfaces of the teeth or covering the entire tooth somewhere. Now, there's an extreme form of this dental fluorosis where you will see flakiness. You can see chalky white surface of the tooth structure can actually be removed. You can actually scrape it with your nail. That's an extreme case. Okay. Now, people could present with just one tooth having fluorosis. They could present with the entire jaw presenting with fluorosis. The other kind of stain we're talking about is drug induced. So, of course, that has come down quite a bit because the general awareness is higher. Tetracycline used to be the drug of the culprit, actually. A lot of tetracycline use has come down, except maybe in rural, second tier, third tier primary healthcare centers where some amount of tetracycline. Of course, there is enough awareness now and people don't use it. But if they have used it, then there is a certain kind of dark yellow brown discoloration of your tooth, which is caused by the drug. Now, these are intrinsic stains, very difficult to remove by bleaching. Am I saying that they cannot be removed at all? No. I'm just saying bleaching is not the treatment of choice if the stains are deeper. So, fluorosis, I wouldn't recommend bleaching if there's generalized fluorosis. If it's localized, you have to bear in mind that when we bleach, the fluorosed part actually becomes more prominent. So the patient will actually feel like the stain is standing out and looking darker immediately after we've done bleaching. So very, very important that this discussion is had with your dentist. I'm more scared, Dr. Rekha, because these days over-the-counter bleaching products are becoming popular.
Like home.
Absolutely. Like home bleach. I agree with you. Now, you have to understand we are dealing with chemicals. You have to follow the prescription given, the dosage, the way of application, the amount of time you need to leave it on your teeth. These are medical chemical products. They do good, but when used wrongly, they can also cause harm. So it's extremely important to understand these are not things we should be playing around with. And bleaching for kids is a big no-no. So I strongly would not recommend bleaching for children at all, unless there's a specific medical reason.
Yes. So if you can, Dr. Ranjani, very briefly, if you can tell what the procedure in bleaching involves, like what exactly the patients are to expect in a bleaching procedure.
So basically, this is in-office bleaching, which means you need to visit a dentist to get bleaching done. We use a chemical from a chemical family called the carbamide hydroxide or the carbamide oxide compounds. They come in different concentration, all the way from 17% goes all the way up to 34%, depending on which system of bleaching we are using. Now, the bleach is a product which is available and it sometimes needs to be mixed, sometimes comes in a ready dispenser. Now, it also comes sometimes with activators, which means there are certain chemicals that are incorporated in it, and only when they are triggered, the bleach starts acting. Okay. Now, what is the trigger? Sometimes UV light is used, sometimes low speed rotation is used, or just manual rubbing. You'll notice that the doctor will use a brush and actually trigger the material on your tooth surface. Now, when you go to a dentist, he or she will first clean your teeth,
Yes.
make the surface absolutely clean, remove all the stains, polish the tooth surface. The tooth surface needs to be absolutely clean and polished.
Yeah.
Yeah. Then the gums need to be protected. So we use what is known as an opal dam or a gingival dam, a barrier that is created so that the chemical at no point in time comes in contact with the gums. It also should not come in contact with your lips or the inner surface of your cheeks. So the doctor is going to isolate your teeth from the soft tissues, use a retractor to pull your cheeks and lips away, place enough cotton, isolate the area so that at no point in time the chemical comes in contact with your skin. However, if it does come in contact, a tiny soft tissue burn can be seen. It will be a whitened dot. It burns a little bit, can be a little painful, but it usually goes away in 24 hours. So the doctor is going to try their best not to, but sometimes the patient could end up touching it, all of that. So then the chemical is applied. There are protocols to be followed depending on the concentration of the bleach. So there are cycles. Cycle 1, cycle 2, over a period of 8 minutes, and then you give a break, you clean it off, go back, reapply for 8 minutes. Sometimes UV light is used. We use optical zoom lights, which is ultraviolet light, which triggers the material and just makes it penetrate the tooth structure a little more deeper. Then sometimes you take a call at the end of 3 cycles and say, okay, I think we've achieved the color we've set out to.
Yes.
Yeah. Usually, before we start the bleaching, we have a shade guide where we let the patient know where they stand in terms of the shade. We also tell them what to expect. So what happens is, this is a high expectation treatment. All cosmetic jobs are like that. People come wanting the sky and the stars and the moon and a bit of the earth too. So it's very important to set the expectations right. I cannot give you toilet seat white, which is what I call it, because everybody wants the extreme white color. Now,
So
which is
many
impossible.
advertisements, and all the celebrities, endorsing, nice, shining white teeth. People, probably their expectations are set a little higher there.
But you know what, Rekha? Instagram filters have made my job a little easier. They now understand that they can also do it at home without having to spend money. So trust me, 5 years ago, it was a nightmare to tell them that I cannot make their teeth as white as they wanted.
Yes.
So we show them a shade guide beforehand, tell them how, from where they are, we can move them 2 shades whiter. That's the maximum I would recommend. There are times when we've gone 3 when the patient has been very pushy or I felt very aggressive on a particular day, but we stop when the patient complains of sensitivity. As a rule, all patients after bleaching require a certain amount of desensitizer just to make sure that their teeth don't become oversensitive. There are precautions to be taken after bleaching: no coffee, tea for the next 24 hours, no nicotine, no smoking. Avoid cola. Anything that can, stain the tooth again is better to avoid. Certain amount of care is required if you want to maintain that. So that's office bleach that we're talking about. There's another form of bleaching called home bleaching. Usually, this is done as a follow-up. So once you're done with office and you mix for longer, then customer need to fabricate that tray in the lab, which will go and fit into your teeth so that the material is in contact only with the tooth surface. So it has to be customized. I know there are a lot of over-the-counter trays available. It can do some amount of damage to your gums. So it's important that you talk to your dentist, get your own customized tray. And there are products available which your doctor can dispense and will also tell you what interval to use it in.
Yes.
You know, the first 3 weeks you don't do anything, then you start off. There are also the wipe on, or what we call as a bleaching veneer. Okay, just like how you get a nail polish finish on your nails, you do get a thin layer of liquid which you can just paint onto your tooth surface. These are what people use just before they go out to a party, or if they have to make an appearance, or if they have
Yeah.
of course, you and I haven't done this before this video, but yeah, we should consider it. But yeah, I mean, somebody actually told me that. They said, don't you guys whiten your teeth before you? I said, okay, I didn't think of it, but yeah, we're dentists, so we should be able to do it. So that's about bleaching products in brief.
Okay. I think that was pretty helpful. But like we said, of course, there would be some side effects to the bleaching procedures. Like you mentioned, there would be some amount of sensitivity, and of course, patients have to know. They have to know and understand that bleaching is not a permanent procedure of teeth whitening. So if it's required for an occasion, or at some time, if patients feel there's some very heavy staining, probably to lighten that, they can undergo a bleaching procedure. So, and like you mentioned, the health of the gums is really important for a patient to undergo bleaching. So if he has very spongy, bleeding gums, he would not be a candidate for bleaching. So I think again it boils down to the fact that patients have to again understand that their basic dental health is very important. That they visit their dentist regularly, and they keep a lot of cavities and gum conditions under check, because whenever there's any of these conditions, a bleaching procedure will be difficult, especially for tooth that has a filling on it and things like this. So I think end of the day, I think the patients should sit with their dentist, discuss with them the option that's available to them in particular, and then decide on whatever methods or procedures would be best for them.
Yes, bleaching can be fun if it's done right. I think Dr. Rekha, we should also address dental jewelry sometime.
Yes.
I'm saying, why should we not have some fun while we're looking after teeth?
Yes.
So please, whenever you get a chance, you should probably talk about dental jewelry and tell people how they can have fun with jewelry and their teeth.
Yeah, we could do that. We could do that.
So please visit your dentist, ask them for a bleach, talk to them, find out which is the best bleaching procedure for you, and happy smiling.
Yeah. So Dr. Ranjani, thank you so much for joining me today, and I hope to get you back for another conversation on the Tooth Talk with your dentist. Thank you so much.
Thank you so much. It was a pleasure.
That was Dr. Ranjani Rao, who did give us some insight about bleaching procedures and who the best candidate for bleaching is. So if you have any doubts or queries, do leave your comments below in the comment section, and we will get back to you on that. You can contact Dr. Ranjani Rao, whose details are given below in the description box. So I will get back to you with another dentist on another topic on your dental health. So until then, keep smiling and be happy.